In the first half of today's show, Moira sat down with Sarah Parshall Perry, mother of 3 children, 2 of whom are on the autism spectrum. She spoke about the challenges of raising children with disabilities and finding God in the midst of all the chaos. Sarah is joining us now, along with Randy Mitchell, whose son Caleb has low-functioning autism, as well as Katy, a behavioral consultant at Geneva Center for Autism. Thank you guys for being here and joining us today.
Thanks for having us.
Thank you.
Well, autism, there's such a broad spectrum of autism, ranging from mild to severe. Katy, explain to us what autism is and what that spectrum is.
Absolutely. So, as you mentioned, autism can look like a lot of different things, and I'm sure when you look at your 2 children, they're completely different. But the similarity that you will see is that there's sort of 2 impairments that we see in individuals who are diagnosed with an autism spectrum disorder. So they're going to have challenges in the areas of social communication and social interaction, and also in the area of repetitive and restrictive interests. So, you know, in an individual with high functioning autism, you might see something like not being able to read social cues, not being able to read body language, having trouble with conversation. And then you might see an individual who is on the other end of the spectrum who can't even communicate using language at all. You might meet an individual who's in love with trains and could talk about it forever, and you might see an individual flapping their hands. And those would both be examples of repetitive and restrictive behavior. So that sort of encompasses all the challenges.
Sarah, you have 2 boys. You have Noah, who's 10, and Jesse, who's 5. And then you have a neurotypical, that's what you call your daughter, Grace, who's in between them. Where are they on the spectrum?
Both of my sons were diagnosed with Asperger's before the DSM changed everything over to autism spectrum disorder. So they have Asperger's, but now we just say that they have ASD. They are high functioning. Very intelligent, really strive to be social, which is sometimes even more challenging because for these high functioning kids, they want to reach out and they don't quite know how. So a lot of the frustration that we experience with them, a lot of the tantrums are because they have difficulty expressing themselves and their hearts are really so tender, but their brains are not providing the appropriate cues for them to interact the way other kids might interact. So they're very verbal. They have been taught through lots of behavior modification to make eye contact. We taught Noah, our oldest, to look right here above the forehead or above the bridge of the nose, and that seemed to help, so he wouldn't have to look directly in their eyes. They both will stim. Occasionally, Noah flaps, Jesse spins, but we've been working on that as well. So they are, at first glance, you would just think that they're a little odd, they're a little eccentric or a little unique, and it's when you dig down underneath those layers that you realize that there are challenges in a number of different aspects.
And Randy, you're kind of on the opposite end of the spectrum. Your son Caleb is 15 and he is low functioning. What does that mean, or what does that look like?
Yeah, so Caleb is, he's 16 and he is at the low end of the spectrum. So he's been assessed at the level of a 22-month-old. So his communication is at that level. It's just been in the last number of months that we actually, he's been toilet trained. So he's been in diapers up until a few months ago. So that was probably our biggest challenge, is working through that with him, and we honestly didn't think that that was ever going to change. We thought he was going to be in diapers for the rest of his life, but it was because of a therapist like Katy that helped us and worked through. And so that was a major victory for our family, is that Caleb was able to go through. So our challenges obviously are different. You know, we're dealing with toileting and communication, and yeah, so it's a big spectrum.
Katy, you implement strategies for progression.
Yeah.
What does that look like?
Yeah, so it looks different for every individual. And what's really important is that we look to the families to tell us what would be the most important behavior or challenge to address right now. And me personally, and at the Geneva Center for Autism, we offer behavior consultation, and we use applied behavior analysis, which is a science of understanding and teaching behavior, not specifically only through language, because a lot of kids like Caleb actually don't speak. We can't just say, hey, it's time to wear a diaper, it's time to learn to use the toilet. That's not going to work. So we use use other principles to teach these skills in a way that works for everybody on the spectrum.
We had communicated earlier about how doctors these days are so quick to diagnose a child with autism, and it's just so often that they're doing this. Why do you think that this has become more prevalent in recent years? What about you, Sarah?
I have a couple of different theories. I'm sort of want to believe that there are differences diagnostically in the classifications that come through school as opposed to those that come through medical clinic. My boys were diagnosed through the Kennedy Krieger Institute's Center for Autism and Related Disorders, and we went through an extensive battery of tests from speech pathologists to occupational therapists to neurologists, psychologists, so that the full realm of the potential for the disability and eventually the disability itself could be analyzed. I think sometimes when the diagnoses come through school, they are more frequent because the kids need to be classified according to what works for the class, what is going to provide associated services, what might be the most expeditious route for things. So I think the school versus clinic philosophy might be a part of that. And I do believe that the rise in the prevalence of autism is also related to the knowledge that people have. It is definitely front of mind. It's the talked about developmental disability these days. So I think the more people are aware of it, the more parents might seek out professionals to see if there's a diagnosis, so they're catching more things.
What were some of the triggers that kind of gave you and your husband cause for concern?
Well, Noah was first, and I like to say that, you know, mothers have a sixth sense, but I think the Lord just really kind of tunes us into a frequency that maybe is not always present with the dads. But I literally knew at 10 months that he was going to be on the spectrum. I mean, no offense, as I have a father who's on the journey with me, right next to me. But at 10 months, which is very rare to get a diagnosis for a kid who is high functioning, I knew that he was on the spectrum because I have a photo of him mid-flap. He was mid-stiffen, and our pediatrician actually said, oh, he's just excited, and he's eccentric, and that's how he likes to express himself. So we went through the journey. I let things develop, but the late walking, the late talking, and the repetitive behaviors were the three big clues for me. And then ultimately, those were the same clues for Jesse, his younger brother, and ironically, when the speech came for both of them, it was, you know, at 2.5, we were getting sentences like, well, naturally, that fireman will fall off the ladder and harm himself. You know, and it was like, we were getting 2 words, and then suddenly we're getting like a professor who's just teaching an entire class on, you know, taking care of our firefighters. So, you know, it was one of 2 extremes, but those were the 3 big clues for me.
Right. Randy, I imagine that this takes a toll on your faith a little bit and on your marriage and just kind of lots of aspects of your life. Talk to me about that. Do you ever have any kind of resentment towards God?
Yeah, I think there was a season in our lives where Sarah mentioned earlier about where you're angry at God. I think it's just a lot of questions, and it's not really what you sign up for as a parent, and it's not the journey. You have big dreams for your kids. We have 2 older kids, and so it's not what you plan for them. But it's not the journey we planned, but we sure do love our tour guide. We've learned so much from him. Actually, I think I've learned more about God having a son like Caleb than prior to that. Yeah.
What about you, Sarah? Has it taken a toll on your
would
marriage?
agree. I think I think there's a natural grieving process for recognizing that there will be parts of your anticipated life that you're not going to get. There was a wonderful poem that was written by an author named Emily Pearl Kingsley, and her son was diagnosed with Downs, and she wrote a wonderful poem called Welcome to Holland, and she talked about all the preparation. And I know sort of in the autistic community, a lot of us hold on to that poem like, oh, she gets us, she gets us. But it really is the experience of preparing to go to a country like Italy and learning to speak Italian and looking forward to eating cannoli, and then all of a sudden the doors open up and there are windmills and wooden shoes, and you go, well, I mean, okay, this is awesome, but it's not what I signed on for, so now how do I prepare for this? So there really is that moment of, oh my gosh, what do I do now? So
right. One of the things that I think is so important that we discuss is, and we had talked about this a little bit earlier, is the public's perception of you as parents. A lot of times people look at it as poor parenting. Randy, you were talking about how when you go into a restaurant, you have to hold Caleb's hands. He might reach over and grab a French fry from someone's plate.
Yeah.
Talk to me about that.
Well, I think the challenge is when you look at Caleb, he looks fairly normal. So if parents or people, if you're in a restaurant or somewhere, they could look at you and think you are a bad parent. But he wouldn't think twice about if we were walking past a table about grabbing somebody's French fry or something like that. And so it is a challenge for us. It makes it difficult for us to do things like that.
Sure.
Yeah.
Katy, how as a community, are we able to come alongside and support the parents?
Yeah, so I think that what you guys are doing here by having parents speaking about their experiences, and it allows people to get educated about autism, that's huge because people with autism are in our communities. And the other thing too is that I think that families really know what they need from their communities, and looking to the families to say, what can I do for you? How can I include your child? Looking at the child's strengths and nurturing those and really emphasizing those, because obviously there are impairments, but people with autism have a lot to offer to the world, and recognizing that and being there to nurture those qualities, I think is probably one of the most important things we can do as a community.
Great. Well, I appreciate you guys coming on and sharing with us your stories.